The following portion of My Carolina is sponsored by...
Welcome back to My Carolina. In honor of Mother's Day, today we are going to be discussing a very important topic, oral health during pregnancy. With us, we have Elaine Leck from Delta Dental and Dr. Rhonda Stephens from the Department of Health and Human Services. Thank you both for being with us today.
Thank you for having us.
Well, I think this is something we don't often talk about. You know, during pregnancy, we cover all the different health options that we need to be making sure that we're taking care of so that the baby and mother stay in good health. But oral health is crucial as well, and it's so important that we talk about this.
Yeah, we usually only talk about the connection between oral health and our overall health, like you said, but we mostly talk about it in terms of our chronic conditions.
Sure.
We talk about gum disease, we talk about the effects of oral health on type 2 diabetes, cardiac disease, stroke, but we just don't often hear, like you said, about the oral health and how important it is for women before, during, and after pregnancy.
For their baby as well. And Dr. Stephens, I think, you know, there's so many things that you're worrying about when you're going through pregnancy. And sometimes it just seems that, you know, our teeth and our mouth, that's the last thing we want to think about, but it's so important.
It should be one of those first things that you actually think about, primarily for the reasons that Elaine just mentioned, is that oral health and poor oral health in particular are connected to a lot of chronic diseases. And so ideally you want to be healthy before you become pregnant, but if you happen to be a pregnant individual that has those chronic diseases as well, then we definitely want to make sure your oral health is up to par for a healthy pregnancy.
Sure.
And so knowing that it is safe to receive treatment all throughout pregnancy, not at any one particular trimester, that it's okay to receive all types of dental services, not just cleanings or not just fillings, but you can also receive x-rays and extractions. And then recognizing that keeping your oral health healthy is great for the mother, but it also has an impact on the child's future oral health. And so it's a continuum that we have to focus on to set the trajectory for that child in the right direction.
You know, I think it's so important that you say that it's okay to have all these other procedures done, like x-rays and the extractions, and have the fillings put in, because we're so concerned about what we put into our bodies during this time. And some of those surgeries can be fairly major, so it's totally okay.
It is okay. So it's always important that we emphasize that the prenatal care provider and the dental provider have conversations.
Okay.
Most women are likely going to be healthy otherwise, but if there are high-risk pregnancies, there might be some particular precautions or things that are taken, but to receive treatment is definitely safe.
Sure, and you're going to be under the care of somebody who's so specialized and knows everything to do to keep everyone safe, including the baby. Now, what's the correlation between making sure that we have the proper oral care and what happens with our baby inside our bellies?
Sure. So mothers who have high levels of untreated tooth decay or who have several missing teeth, their children are more likely to have high levels of untreated decay as well as missing teeth.
Wow.
And so if you have a lot of untreated decay while you're pregnant, you can actually pass that same disease-causing bacteria onto your child. And so the child is born with larger amounts of decay-causing bacteria in their mouth that can set them up for tooth decay once their teeth come in.
I think I need to close my mouth because I had no idea that that was even a thing. And I'm sure many of our viewers felt the same way. So it really, really is important because you're setting your baby up for the proper care and nutrition.
Or success or failure.
Right, before he or she's even born. Now, are there any other things that we need to be making sure that we've pay special attention to during our pregnancy?
So obviously nutrition. So I will say there's this myth that with every child you lose a tooth or that your child is leaching the calcium out of your teeth. It's likely a matter of nutrition. So when you have cravings, things that are traditionally probably not healthy for you, and you're taking that in a lot, in addition to morning sickness and vomiting, that puts your teeth at higher risk for tooth decay and loss, not the baby itself. And so I think just watching your nutrition, seeking, like I said, professional care are the two critical things to just ensure a healthy pregnancy and a healthy oral health for your baby and you.
Great advice and great tips right there. Like you said, I had to close my mouth during that one statistic, something I never even thought about. And I'm sure there's so many other things mothers are worried about. Where can we go for more information?
Well, for Delta Dental, it's deltadentalnc.com.
And for the North Carolina Oral Health section, I believe the information is on the screen.
Absolutely. Well, we appreciate both of your times today. And I know all the mothers and fathers out there and babies are very thankful as well. Thank you so very much.
Thank you.
Thank you.
The preceding was sponsored by